Hi, my name is Kamaljeet Kaur. I'm a student at United States University. I'm a student nurse practitioner at United States University. Today I'm making a thorax lung examination video with my son Gurnoor Singh, and I'm giving the consent to upload this video on YouTube under unlisted title so my professor can see this video and she can grade my work. And before starting this video, and I'm going to give a 360 view of this room. So this is the first wall, this is the second wall, this is the third wall, this is the fourth wall, door is closed, this is the fourth wall, fifth wall, this is the roof, and this is the floor. Now I'm gonna put the camera back and I'm gonna just adjust the camera again. So I'm not using any kind of clues. So I'm making this video all by my memory. Before starting this video, I'm just have already washed my hands, but I'm still hand sanitizing my hands. I'm using the hand sanitizer. Put that on. Okay. So I'm making the lung and thorax video today. So first I'm starting this video with the inspection. For the inspection, I'm just like starting this video with the visual inspection, and for visual inspection I'm just like inspecting the chest wall, and I'm just looking for any deformities anteriorly and posteriorly. While I'm looking for any deformities, I will look also for the expansion, and I will look for the rate and rhythm and the breathing pattern, and I will look for the if patient is using any accessory muscles, if patient is using any diaphragmatic breathing, if patient is using uh, any the pattern of the breathing, if patient is like how patient is breathing, the normal that by looking like it seems to be patient is having like 16 to 18 beats per minute, which is like a normal breathing. If it's like more than 25 beats, it's called tachypnea, and patient is not using any accessory muscles while he is breathing. And I will look at the posterior parts as well. Patient is not using any accessory muscles posteriorly as well. um, the rate is normal, patient is breathing normally, he's not not using any respiratory accessory muscles. If I look at the AP ratios from transversely, so if like I look at the transverse angles for the AP ratio, which is 1:2, and it is normal, and I did not notice any symmetrical problem in the inspection. So I have find like everything normal, and now I'm gonna move forward inspecting his fingers, his nails, and I did not find any clubbing of the fingers, and no cyanosis. The skin color look normal, and the lips appears normals, and the color of the skin is normal. No clubbing of fingers noted. So this concludes my inspection, and I'm moving forward with the palpation. For palpation, I'm going to do the first respiratory excursion or expansion. For respiratory expansion, I will check first the symmetry of the chest. For this one, I will make a fan with both of my hands, and I will place both of my thumbs in between the middle of on his chest. Can you get it please sit properly? Can you just forward like this? I will make a fan with both of my hands, and I will place my both thumbs in between the center of his chest, and I will make a fan with both of my hands. Can you please inhale and exhale, like take a deep breath and just take his breath out. Okay. So while he is taking his breath in and out, so I will look at the movement of his chest and also at my hands, the symmetry of my on his chest. Take a breathe and out. Okay. When he's taking his breath in and he's taking breath out, so I will look at, I have looked at my hands. It's in the symmetry. It's like both the hands going up and down in the same position. So I did not notice um, any like problem in the hands. They are both in the same position, so it means there is no problems. I have did anteriorly, so I need to do it posteriorly as well. First I will do all the exams anteriorly, then I will do the exams posteriorly. Now I will do the tactile fremitus anteriorly, and then I will do the posteriorly as well. For tactile fremitus, I will use the ulnar side of my hands, and I will ask the patient to ask 99, and I will make a comparison with both hands for to find out any abnormalities. Gary, when I'll put my both hands, just say 99. Okay, say 99.
99, 99, 99,
Just learn.
99, 99.
Okay. When the patient was saying 99, I feel the nice vibrations on both my hands, and I did not notice any abnormalities. I feel the same vibrations. If I feel any consolidations, it means patient have any kind of problems going on, but I did not find any abnormalities. It means patient does not have any problems going on. Now I'm going to do the costochondral tenderness. For this, I need to like, press the in between the intercostal spaces and the costal region, and I'm going to ask the patient if he feels any pain. Gary, I'm going to press here. If just let me know if you feel any pain. Do you feel any pain?
No.
Any pain? Okay, the costochondral tenderness is negative. It means the patient does not have any pain. So I'm going to do the palpation on the posterior side for respiratory expansion or excursion. So I'm going to check the symmetry posteriorly, or I'm going to check the tactile fremitus posteriorly now. Gary, can you just please put your back on the camera? And just put your tongue over there. So just this way. So I'm going to make a fan with my thumbs again, and I'm going to just put the hand on the angle here, on the near about the 10th intercostal space over here. So I'm going to just like take a little skin in my hand, just take a breathe in and out. Okay, so my hands going in the same way up and down, so it means there is no problem. Chest is in the symmetry. There is no problems going on. Patient does not have a problem with the respiratory expansion. It's all good. And now I'm going to check for the tactile fremitus posteriorly. I'm going to ask the patient to say 99 again. Now I'm going to use the ulnar side of my hand. Can you say 99?
99, 99, 99, 99, 99, 99.
Okay, so I feel the same vibrations on both hands. So it means there is no consolidations going on. Patient does not have any problems. This concludes my palpation. I did not find any problems in the palpation. So patient does not have any problems. So now I'm going to move with my percussion. Okay, you can sit forward. So now I'm moving forward to percussion. In the percussion, it needs to be done side to side, and this is like important to make the comparison, so we can make comparison while doing percussion from side to side. And in the percussion, I will use the middle finger of one of my hands, and I will use the middle finger of my one hand, and I will use my middle finger of my right hand, and I will tap on the middle finger on the distal end of my left hand. Then I will percuss on the anterior side and on the posterior side. So now I'm going to start percussing on the anterior chest. Okay, can you just sit straight? So I will start from the apex. So I will use the left hand, and I will use the middle finger of my right hand, and I will percuss. I will start from the apex. I will do this side to side so I can make the comparison. So I have feel resonance in all areas. So now I will do the percussion posteriorly. Gary, can you just please put your back on the camera? So we will use the same side to side method, so we can do the comparison. So I will place my left hand, and I will percuss on the left middle finger on the distal end with the right left middle finger. So I have feel the resonance in all areas. I did not feel any dullness. If there is any dullness, so it means patient have the fluid in the lungs, or patient have any kind of pneumonia or any kind of lung problems going on, but I did not feel any dullness. So it means patient does not have any kind of problems going on. So now I will do the diaphragmatic excursion. We need to do it on bilaterally. So for diaphragmatic excursion, I'm gonna ask my patient to inhale, exhale, or hold the breath, so I can just find the resonance to dull, so we can just measure that area. Gary? So just inhale, take a breathe, and then just take that or exhale, or just hold the breath, okay? Now the voice, now the sounds has changed from a resonance to dull here. So I'm just gonna make a mark over here. Now I'm gonna ask my patient to inhale and hold the breath, so we can just make the take the measurements for diaphragmatic excursion. Gary, now just inhale or hold the breath. Inhale or hold the breath, so we can just again measure them. Now the voice has changed, the noise has changed here. It's 3.6 centimeters, which is normal. So normal is 3 to 5 centimeters. So patient has a normal diaphragmatic excursion. Gary, thank you so much. Now you can move this one. So this has concluded my percussion. So now I'm gonna just move to my next exam, which is called auscultation. So for auscultation, I'm gonna use the side to side or ladder fashion. So for auscultation, we're gonna just auscultate all the lung fields. So I'm gonna start, auscultate the apices, the anterior lungs, the posterior lungs. So we're gonna auscultate the left lateral, right lateral. So we can make the comparison. So I'm gonna start auscultating the all lung fields. So I'm gonna start from the anterior side first. I'm gonna start from the apices. Can you just take the full breaths, okay? Take the deep breaths. Take a deep breath in. Breathe in. So I have listened the vesicular sounds. Now I'm gonna listen the lung fields posteriorly. Gary, can you just put your back to the camera? So I'm gonna listen. So I'm gonna just auscultate the lungs posteriorly now. I'm gonna start with from the apices now. Take a deep breath. So I have listened all the vesicular sounds. I did not heard any kind of wheezes, I did not heard any kind of wheezes, any kind of rhonchi, any kind of rails. So this concludes my auscultation. So it means my patient does not have any kind of lung or thorax issues going on. Now I'm moving forward with the specialty test. So now I'm just like now moving forward to the specialty test. The first specialty test is called bronchophony. So in this bronchophony test, I'm gonna ask my patient to say 99 when I'm gonna do the auscultation. If I'm gonna heard the clear 99, so it means patient does have some kind of problem going on, some kind of consolidation going on in the lung field area. If I'm gonna heard the muffled or indistinct sound of 99, so it means patient have the negative bronchophony, or patient does not have any kind of lung problems. So first I'm going to proceed with bronchophony, and then I will move forward to egophony. So first, Gary, I'm going to ask you to I'm going to just put the stethoscope, and I will ask you to say 99. Okay, so I'm going to do this one. Say 99.
99, 99, 99, 99, 99, 99, 99, 99.
So I did not heard a clear 99. I was just heard a muffled sound. I'm gonna just heard this posteriorly as well.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. So I did not heard a clear 99. I just heard a muffled sound. It means the bronchophony test is negative. My patient does not have any kind of lung or thorax issues going on. So I'm gonna move forward to the next specialty test, which is called the egophony test. In this test, I'm gonna ask my patient to say E. And if I'm gonna heard the E sound, it means it is negative. Patient does not have any kind of lung or thorax issues going on. If I'm gonna heard A, so it means patient does have some kind of like a problem going on with the test. Gary, I'm gonna just like put the stethoscope again on your chest, and you're gonna ask E this time, okay?
E, 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 E.
Okay, can you just put your back to the camera again?
E, 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 E.
Okay, thank you. So I heard the E sound, so it means the egophony is negative, and my patient does not have any kind of problems going on. So all the tests are negative, and I did not find any abnormal findings in my patient. So this concludes my lung and thorax examinations with my patient. Gary, do you have any kind of questions for me? Thank you so much for helping with my examination. Thank you, Professor.